To start, yeah, if you can just tell us a little bit about yourself and your background, how you got into massage and...
I used to be a judo teacher actually when I was in my early 20s. I did that for a few years. I've always been fairly sporty and into really like the martial arts stuff. That was my sport, judo. Then later on, I studied massage, reflexology, aromatherapy. And after I finished, that was a year-long course. After I finished that, I went to Singapore and I lived and worked there for a while. And then came back and went straight over to Spain, to the Canary Islands, where I worked and lived for another 12 years or so, 12, 13 years. And I just sort of set up my own clinic there. I worked in spas, I worked in multidisciplinary clinics, doing a whole range of different treatments. And then it wasn't until I came back from Spain that I studied the sports massage. The year I graduated from that or qualified from that, it was a 1-year course. I was asked to teach for the college at the London School of Sports Massage in London. And I started as an assistant. And after a couple of years, I became one of the lead tutors. And then they gave me my own school in Brighton, which I ran for about 3 years. And then I came to ICOM. And so it's the sort of, yeah, that's a summary of my journey and experience with sports massage. So lots of sports massage and lots of massage, basically.
I must say, I think for me, having been one of your students, I think you're always one of the best teachers. Just your general knowledge of all Chinese medicine, and you have such an incredible ability to make things simple and easy to understand, which you can then add to the complexities later. So I think anyone looking to do the course, I think, will benefit hugely from your kind of experience and your way of teaching.
Thank you. That's very kind. Yeah. I think I keep it simple because I have to learn that way myself, you know. And I like to try and think of silly ways to remember things that aren't easy to remember.
How much do you combine the two in your practice, the massage with the acupuncture?
A lot, actually. Well, if you look at the statistics, the reason that people come for acupuncture, the number one reason that people come for acupuncture is for lower back pain. And the second reason that people come is because for other musculo-skeletal problems. So you're looking at neck pain, hip pain, shoulder pain, knee pain, you know, all of that sort of stuff. And so I think that this is something, like it or not, that you have to kind of be good at. And because you're going to get a lot of it in your clinic. And if you don't feel comfortable doing these things and you don't feel confident treating these issues, then you're going to miss out on quite a lot in clinic. So for me, it's really enhanced my clinic and how busy my clinic is because of having these musculoskeletal skills and being able to, and everyone loves a massage, let's be honest, you know. So if you've got lower back pain, you don't, you know, just having needles in, which is great and will often help the problem, but combining that with a massage is almost like twofold the results.
Do you find that the results improve with the body work as well as the needles?
Absolutely. Absolutely, because you're relaxing the person's tissues, which are obviously tight, and you know there's stuff going on there, but we can assess what's going on and why they've got to the state they're in with the musculoskeletal knowledge and the skills that we gain from doing this sort of course. And then once we've treated that, we can then bring in the acupuncture and the Chinese medicine side of it. So you've got this real amazing combination that kind of gets it from all angles.
Sure.
And
do you always do it in that particular order? You always massage first before doing the needles?
I do, yeah.
And why is that? Because of this sense of kind of relaxing the kind of exterior?
I've been doing massage for much longer than I've been doing acupuncture. So I guess it's just it's what I know, it's my go-to thing. But also I like to relax the person before I stick needles in them,
sure.
If possible. And secondly, it's not just a physical relaxation, it's a psychological, emotional, stress relieving experience for them as well, which is so beneficial for the mechanisms of acupuncture to work more efficiently, in my opinion, in my experience, you know.
And how much does the the massage skill or the palpatory skill that you learn with the massage inform your choice of acupuncture points or what you do? Do you use it as in kind of diagnostically to inform your Chinese medicine practice?
Yeah, definitely. I'll assess them from a Western medical kind of musculo-skeletal point of view, but then at the same time, I'm taking their pulse, I'm looking at their tongue, I'm doing the palpatory skills, I'm looking at the channels that are affected with where their pain is. I don't know, for example, a tennis elbow, you've got, pain all the way down the colon channel. And so you not only, this is what I've been doing recently, treating somebody with tennis elbow, and you're releasing the extensors that, literally do this with your wrist and go all the way up to your elbow. You're releasing all of those all the way down, and then you're needling in the colon channel. And combined with that, you can needle a trigger point, which will deactivate will deactivate the trigger point and release a lot of tension. So it's just a really lovely combination to be able to put them all together.
It's interesting. Last week, I had a patient come back and she actually was wanting massage, and it kind of felt quite disappointing. I can do acupuncture, and I was confident that the treatment was going to work. And then she kind of came back and she kind of said, actually, I have a feeling that my body needs massage instead. And I'm kind of like, oh, damn.
Yeah.
And I think people, kind of want both, or they want to have the flexibility to be able to have both.
Yeah. And it happens a lot. And I think that it happens a lot more than we think it will happen when we're studying acupuncture and when we're graduating or when we've just graduated. When you ask somebody if they've had acupuncture before, 50% of them will say yes, but it's been acupuncture, which we would call dry needling. And so, if you've got a skill that covers both of those modalities, like I say, you're quids in, because you can treat everything. And those skills can be learned relatively easily. So
sometimes it's important to be able to realize that I've had patients that have had dry needling before, and they seem to have an expectation that I'm going to treat in the same way, and they're going to feel the same things that they felt before, of coming for neck pain, and they feel a shooting sensation up. And if it's almost because they don't get that, because we treat in sometimes different ways, they're not going to get better because they're waiting for that kind of psychological feeling to show them that, yes, this is all going to be fine.
Yeah, when people come in for pain, they want their pain to go. That's their number one reason. That's why they come in. They want their pain to go. And if you can deal with that, whether it's with massage or whether it's with sticking a needle in a trigger point, then bingo, then you can treat and put your needles in your normal points that we'd use for neck pain. Then yeah, and there's a lot of people that come in that, like I say, that say, oh, I've had acupuncture before and it really helped. And you have to say, where did you have your acupuncture? Who was it that gave you your acupuncture? Because if you don't ask that question, you as an acupuncturist are going to assume that they've had Chinese medicine acupuncture, and they know about pulse taking, they know that you're going to look at their tongue, that you might palpate their abdomen and all this. And then when you do it, they think, what the hell's going on here? I often end up saying to people, what kind of acupuncture have you had done before? They say they've had a physio stick some needles in them. I know it's a dry needling type of acupuncture. And so I say to them, okay, so what I do is Chinese medicine acupuncture, but I also will treat the problem like the physio did for you. Yeah. So they all know that they're getting two different, and I'll gradually convert them over into the thing that I think in their case is going to be more beneficial to them. That may be a trigger point needling, or it may be Chinese medicine acupuncture.
Alison, can you talk us through the course that you're going to deliver at ICOM, and maybe also, if that's what you're going to do, how much Chinese medicine you're going to integrate into it, or are you going to bring in acupuncture practice into what you teach as part of the remedial massage course?
Yeah, so the course that I'm going to teach is an accredited course. It's accredited by the Federation of Holistic Therapists, and it runs over 12 attendance days. So at the moment, the one that we've got running starting in April will finish in September. There is work to be done at home. I would suggest about 4 hours of practice per week. And I'm
Is that
talking about,
practical work, Alison?
yeah, practical work, if possible. And then there's a written assignment, which is done little by little throughout the course. You do that at home. And so you take something from the lesson that you've learnt that week, you take it home, you answer the question in the written assignment, etc., etc. And that goes through all the way through the course, and that has to be done by the end of the course.
Is that like a portfolio, Alison?
No, there are case studies as well, which I'll talk about in a second, but that's a written assignment, which is a load of questions that relate to what's being taught in the course. And you have to be able to answer those questions, confidently, to be able to pass the course. And then the other part of it, which is assessment part of it, is 12 case studies, which are, you have to see somebody 3 times, and I give a template of how you put your information together that we need. And it's just about the progression and what happens and how you treat them, what their injury is, etc., etc.
So is that 4 patients that you have to massage 3 times as part of your clinical hours, basically?
Yes, yeah. And then in addition to that, there are 24 treatment logs. Now, a treatment log is all of these are requirements that are laid out by the Federation of Holistic Therapists. So a treatment log is something which can be a lot shorter. So, for example, your partner has neck ache one day, you go in, you spend 10 minutes, you do a little bit of soft tissue release. That's 1 treatment log done. So, you can, it's a 10-minute, this is what I did, this is what it was, this is what happened. That's
you can bite-size it, basically.
So these are these are little snippets, but you have to do 24 of those throughout the course. Let's say you've attended the course, you haven't been able to finish all your homework and your case studies, let's say. You have 3 months to complete it. So you have until the end of the year, this year. But the coursework has to be completed preferably by September, otherwise you won't get the qualification. If you haven't done it, you can complete it and hand it in by the 31st of December and start the new year with a new qualification. And we're going to be learning the basic massage techniques that will, that just tide you over, that you'll learn everywhere, anywhere you go. But I'll also be adding soft tissue release, which is a type of myofascial release technique, some neuromuscular techniques, which deal with trigger points, which I mentioned earlier, and some friction techniques, which is also a neuromuscular technique. We'll be looking at postural tendencies, postural assessment, to be able to look at somebody and say, okay, they've got a tight upper trapezius and a tight quadratus lumborum, and I can see that there's an imbalance going on here. So, and then learn how to assess and treat those. You get an accredited qualification, which is a level 3 qualification. It's accredited by the Federation of Holistic Therapists, and you become a remedial massage therapist, and you can go out to work immediately. You get your qualification as soon as you've got your insurance, which you can get from Baylands, or if you're already a practicing acupuncturist, the MBAcC will cover you. And then you can go out and start earning money straight away. And if you want to do just massage on its own, as an extra to your menu of offering in your clinic, then you can do that. Or you can combine it like I do with acupuncture. So I don't do massage on its own anymore, but I've been doing it for 30 years and I'm old. And but one of the things that are key things that I learned and that I now teach is how to use your body weight correctly so that you don't compromise your own health. People that do, when you go to a spa, as lovely as some of the massages are, if you want a deep massage, you're probably not going to get it. And when you see the massage couch coming up higher and higher and higher, what this means is the massage therapist is going to be using their arms all the time, and they're going to get tired. Whereas when we teach, and this is the thing that I learned that gave me another 15 years of massaging, is the massage couch goes fairly low, and we use our body weight to get behind the treatment that we're doing, and you can go on for a lot longer and get a much better treatment from it. So,
and more longevity as the therapist as well.
Definitely, definitely.
And Alison, are there prerequisites for entry?
There are, yes. So students need to have passed their anatomy and physiology
at level 3.
or above.
Okay. So is the course only for acupuncturists, or anybody who's got that prerequisite anatomy and physiology can join?
Anybody that has that prerequisite of anatomy and physiology. However, if they haven't been working for the last, it needs to be within the last 5 years if they haven't been practicing, that they gained that qualification. If they've been practicing, it doesn't matter how long they've had it for, they can join as a practicing therapist as long as they've got that prerequisite. Yeah.
And there's an exam?
There's one practical exam at the end.
And what does that look like, Alison?
Okay, so that covers everything that they learn, and it looks like they get a body that comes in, so they can bring a body in with them, and they have to do a quick postural assessment, and then they have to decide how they're going to treat that person. Okay. And all we do when we're examining is we will go around and we say, okay, what have you found on your body? How are you going to treat it? What techniques are you using? And that's it. And they do a massage as if they were in their own clinic. It's weekends, or it's mostly Saturdays. And there, I think, are a couple of weekends where they're Saturday and Sunday together. We've got June is no-go zone because of so there are no classes in June because of the quantity of work that there is in, particularly in ICOM, for the students and exams and stuff like that. So it's a pretty heavy loaded time. So we've given June off, and then it carries on. So April, May, and then June off, and then July, August, September.
Actually, getting a lot of value from your expertise, and it sounds like a lot is covered in a good time span where you can kind of start to apply what you're learning in the clinic and to kind of explore how to get good results. It sounds super exciting.
I really, my aim with this is to give people the confidence and the skills to be able to make a big difference to people when they come into the clinic, when they've got pain scenarios with musculo-skeletal issues. And this is slightly more, even though it's pitched at level 3, that wasn't my decision, that was FHT's decision. The quantity of stuff that you're getting in this course is actually a little bit higher than that. So you won't get a level 3 course that covers what we cover in this course.
This seems like a no-brainer. If 50-60% of our patients come with pain conditions, to be able to use the combination of massage in all various forms plus acupuncture, it really does seem to give you the best chance to treat any patient that comes through the door.
Yeah, and there's something as well about the palpatory confidence, isn't it, that you touch people and that you can do things with that sort of ease and confidence because you know what you're doing.
Absolutely, that for me is key. It's put the top of my priority list when teaching. There are a lot of people who put their hands on someone to do a massage, and you can almost feel immediately that whether this is going to be a good massage or a bad massage. It's not just about doing a movement, a routine movement of massage. It's about connecting with a body and that body's soft tissues and where that person's at. And there's a hell of a lot more to it than just putting your hands on someone and doing a bit of petrissage or something. We can all do that, but the palpatory skills that I teach, we do a little exercise where you take a hair off your head if you've got hair on your head. If not, you can borrow it from someone else, and you put it under a piece of paper, and you give it to another person, and they have to locate the hair under the paper.
Brilliant.
And it's really key. It's really interesting to see. Obviously, some people have thicker hair than others, so it's easier. But it's amazing how you can really hone your palpatory skills by doing little things like this.
Which presumably helps your pulse diagnosis, point location, and all these other techniques that we need as acupuncturists.
Exactly. Yeah.
And does the course come with notes, Alison? Are you giving them notes and this kind of thing?
Yeah. So when people sign up, I will provide them with and I know some people have already signed up and they haven't got this yet, but they will get it if they're watching. A course manual and some basic documents that were like a reading list and stuff like that, and the course schedule. So what's taught in each lesson. During the course, I'll be giving handouts and information that they can use. I encourage them to get, there are 3 books that I've said are essential on the reading list. They're not expensive books. They're sort of 20, 30 pounds max. And that's it. That's it. You know, it's really heavily based on a lot of practical skills.
Fabulous.
That sounds awesome.
Good.
Wow. Well, thank you so much for your time and to go through. I think it sounds like such a great course to do, and I think anyone will really benefit from it. So thank you.
Good. Well, I look forward to seeing you both there.
Yes. No, but I think, you know, some sort of body work is utterly essential as acupuncturists. You need some palpatory skills and techniques, even if just to put your patients at ease.
Yeah, definitely. Definitely.
Brilliant. I look forward to it.